Other general questions and comments that we're hearing, there are a lot of concerns about the public's being at risk because they were not notified of increased activity or individual deaths at the Niagara Health System. I need to emphasize again that C. difficile is in every hospital at any given time. It's really important to understand that. Whether it's Niagara, Hamilton, Toronto, any hospital across the country has C. difficile. Our focus has been and will continue to be internally to get out of the outbreak and to ensure that we have no further outbreaks. We want to assure you, though, that we have been in regular contact with Niagara Regional Public Health on the issue, and they continue to be part of our twice-daily teleconferences to analyze our data and ensure that proper interventions are in place. It also would be an infringement of patient and family's confidentiality and highly unusual for any hospital to report individual deaths. Hospitals do report C. difficile rates to the Ministry of Health every month, and they're publicly reported on our website, and they have been since 2008. As soon as the outbreaks were declared, we moved to publicly report C. difficile related deaths that occurred, and this is consistent with the practice of other hospitals. There have also been a number of questions about the cleanliness of the hospitals. We have had 3 resource teams meet with us in the past number of weeks. They were impressed with the level of cleanliness and offered some suggestions, such as removing magazines and newspapers that people have touched and then someone else could touch, which we've already implemented. When we invited the provincial resource team, they recommended that we shift our focus on the things that I talked about earlier, like walls and cleaning and etc. We understand that our buildings are older, and that presents a very great challenge when it comes to the appearance and cleanliness, or the appearance of cleanliness. We've just recently now implemented a contact line for members of the public to call should they have concerns. So if they see something that they think is not clean, they can call that number, and that will be reported immediately, and our housekeepers will be paged to come and clean that area. We welcome these calls. Officials from the Niagara Public Health Department, including the Associate Medical Officers of Health, the Coroner's Office, and the Provincial Resource Team have been very supportive, and we thank them for their support. Each of these agencies have been with us shoulder to shoulder every step of the way through the outbreaks, and we really appreciate their support and involvement.